CDC, the beginning. Child Development Center, CDC project at SAT Hospital, Medical College, Thiruvananthapuram was started on 1st August 1987 as a PhD research project of Dr. M.K.C. Nair, Government of Kerala. It was declared that to increase the outreach of the public health system, a unique scheme has been started for early detection and treatment of childhood disabilities as a public health program with community participation, which will be a model for the entire world in the next decade. Clinics. CDC conducts high-risk newborn follow-up and intervention under 3 separate clinics. These include the Early Stimulation Clinic, offering early developmental stimulation to all newborns born with birth weight less than 1,800 grams till 1 year of age. The Late Preterm Clinic, offering periodic assessment and early intervention for late preterm babies born between 34 weeks to 36 weeks and 6 days of gestational age. The At-Risk Baby Clinic, where other babies who are more likely to develop developmental delay and hence require regular follow-up at fixed intervals are enrolled. Development Evaluation Clinic or DEC Clinic. At CDC, development assessment is done at DEC 1, DEC 2 and DEC 3. DEC 1 Clinic. Children between 0 to 3 years who present with developmental delay are referred to DEC 1 Clinic. DEC 2 Clinic is for early identification of developmental and learning problems of preschool children along with their behavioral issues. DEC 3 Clinic is for 6 to 12-year-old children. Preschool Intervention Clinic, that is 3 to 6 years, is the preparatory stage before the child is put into the formal education system. Speech Clinic. At CDC, children who are found to have deficit in age-appropriate speech during regular follow-up, as well as those referred with delay in speech, receive intervention from 2 separate clinics. Speech Stimulation Clinic provides early language intervention. Children less than 18 months who have delay in LEST and those who have delay in reels above 18 months of age are registered in the clinic. The mothers are then given pointers on how to stimulate speech in the child by creating a language-rich environment around them. They are regularly followed up, and if they are found to be not improving, they are then referred to the formal speech therapy clinic. Speech Therapy Clinic. Children referred to CDC with speech delay undergo formal assessment by the speech and language pathologist using tools such as reels. Their deficit in receptive and language fields are noted. The hearing capacity is also ensured. ASD Clinic is a diet of deficits in socialization and communication along with few repetitive restricted patterns of behavior. Attention Deficit Hyperactivity Disorder Clinic, ADHD Clinic. ADHD is characterized by hyperactivity, impulsivity and inattention that causes functional limitation in a child. Interventions for learning disability. Poor scholastic performance is a common presenting complaint of the children brought to CDC. Many a times it is due to neurodevelopmental disorders such as specific learning disability. Occupational Therapy Clinic. Children with neurodevelopmental disorders such as autism spectrum disorder, attention deficit hyperactivity disorder, intellectual disability, etc. benefit from occupational therapy. The genetics team is headed by Dr. Shankar VH, Professor of Genetics, SAT Hospital, Thiruvananthapuram. Ophthalmology Clinic. CDC conducts an ophthalmology clinic on all Fridays, headed by Dr. Ravi Kumar, Professor of Ophthalmology. Neurology Clinic. Many of the neurodevelopmental disorders seen among children require a detailed evaluation by a pediatric neurologist. Children having autism spectrum disorder, attention deficit hyperactivity disorder, specific learning disability, epilepsy, cerebral palsy, and neuromuscular disorders are assessed by a pediatric neurologist, and appropriate management is provided. Courses offered at CDC. CDC offers various courses in the arena of clinical child development, developmental and behavioral pediatrics, and other fields related to child health and research, which are designed to generate a cadre of qualified professionals. These include Postgraduate Diploma in Clinical Child Development, PGD-CCD. The center offers a regular course started by the Director of Medical Education, Government of Kerala. This is the first course of its kind in India, designed to create qualified community-level trainers in clinical child development for prevention of childhood disability. The graduates are known as developmental therapists and can effectively deal with all areas of early library. CDC has a well-equipped library stocked with textbooks relating to pediatrics, neonatology, neurology, obstetrics, etc., along with multiple peer-reviewed journals pertaining to the field of neurodevelopmental disorders. The library also has internet connectivity, and its calm, serene atmosphere is most conducive for an afternoon of quiet learning. Administration. CDC has a strong administration team under the guidance of the Finance and Accounts Officer and the Registrar. The team of various clerical and supportive staff under them make the day-to-day running of CDC very seamless.